Hello, hello again. It's Nana Konamah here, and as always, I am here to help you find your authentic self. July is Fibroid Awareness Month, which means I've dedicated my entire platform to bring much needed awareness to fibroids management, and everything else surrounding fibroids. Today, we are joined again by Dr. Jacqueline Anita Sowah. Last time, we talked about risk factors and symptoms of fibroids, and today we get into the nitty-gritty about treatment options for fibroids and fibroid management. Hi, friend. I'm so glad we get to to have this discussion. So we talked about symptoms last time. We talked about risk factors last time. Now someone says, okay, I checked on my symptoms. I presented with a few of these symptoms. Based on some of my risk factors, I decided to go check if I had fibroids. I found out I had fibroids. What next?
Okay. So as we talked about in our previous video, fibroid may be without symptoms. So if it's an incidental finding because you just want to go and check because of the things you probably may have heard about fibroid, if it's not really giving you any problems, then there's really no need to have anything done about it. Because first of all, let me just jump the gun. I'll go back again. Even the surgery in removing the fibroid alone can pose a risk of something we call adhesions after surgery. And I mean, it can also, prevent you from having a child, because if the scar tissues that have formed, and if you're not lucky, your tubes may all be involved in those scar tissues and may prevent you from being able to get pregnant.
So the surgery already poses that
risk. The surgery can also, not that necessarily it will, but it can also pose that risk to you. So if really there's really no reason, it's just an incidental finding, then that's fine. You can just go about your normal day-to-day business or activities. But you can also do regular follow-up just to see if the size is increasing or if the number is also increasing. Yes, but either than that, because there are people who have had fibroids, didn't even know they got pregnant, they've been able to have all the children they wish to have in the world. So yes, if it's an incidental finding, there's no need for any immediate treatment or any treatment whatsoever. But also depending on the size. Yes.
As in the size of
the size of the fibroid and the location. If you are ready to probably have children and you've been trying to pair the symptoms we listed before. Let's say a woman comes with you with her partner for infertility treatment. They've been trying to conceive for over a year after marriage and they're still not able to get pregnant. You may want to investigate both couples. Now, if you find out that there's really nothing wrong, maybe the husband's semen analysis is normal, the woman, everything else is normal, and probably you investigate and she has fibroids, and location of the fibroid, depending if it's in the uterus. So we call it submucous.
Yes.
Or close to the opening to the tube.
Like I had.
Yes. Close to the tube, then yes, you may think, okay, this may be the cause of her infertility. So you may want to have surgery for her. And usually...
I love that you mentioned investigate both couples, because sometimes we put the burden of infertility on women's bodies.
Exactly. And it's the same equation. I mean, the same percentage that women will be infertile has the same percentage in men too. Wow. So usually when you have infertile couples, you have to screen both of them.
It's 50-50.
Exactly. Right. You have to screen both of them. But I mean, in our society and our environment, women are always the vulnerable ones. Yes. So yes, so you screen. If the doctor thinks this is the cause of the infertility, then yes, you may want to have the surgery done for her, which we call myomectomy, removal of the fibroid. Also, if the patient comes with the bothersome problem is heavy menstrual bleeding, there are medications that we can give to reduce the bleeding. Yes.
Like what?
So we have, you can put the patient on something we call combined oral contraceptives. Yes, they also help reduce the bleeding as well. And then progesterones, they are hormonal drugs.
So hormone therapy is possible. So there's surgery and there's hormone therapy.
Yes, exactly. For those in the reproductive age who wish to have children. Yes, and then we have the other type, which is the hysterectomy, for those who have completed their families or the older women who are not interested in any fertility issues, then that one will have to take out the whole uterus as well. So if also the bleeding is from a type I mentioned earlier, which is the submucosal fibroid, which is in the endometrium or in the cavity of the uterus, then you may want to take it out.
Right.
Yes, because I mean that is what is causing the bleeding. And even if you give these medications to reduce the bleeding, it may continue bleeding.
So we've covered sort of 3 medical approaches. So the surgery, and even within surgery, there's fully invasive,
and
minimally invasive.
Exactly.
Can we talk a little bit about the different types of surgeries?
Okay, after this.
Oh, so we're not done. Excuse me.
So also, if the patient comes with pressure symptoms,
okay,
you may also want to find out what kind of pressure symptom the patient has. You know, if it's about pain too, you may want to give a form of analgesia to relieve the patient of the pain. And then for the pressure symptoms, if there's really nothing to do, then you may want to have surgery for the patient. And then also, depending on the size, there are some medications which you could give to reduce the volume of the fibroid to make it operable. Because some fibroids, some women will come with very huge fibroids. Yeah, so there are some drugs that we could give to reduce the size of the fibroid to make it operable. Yes.
So are those non-hormonal drugs, or those are still, they're also hormonal?
Exactly.
So
some are hormonal, some are not hormonal.
Okay.
So yes.
Got it.
It depends.
Got it. So it sounds to me that typically when it comes to surgery, doctors like to leave that as like the last
resort. Yes.
Okay.
Because of because every surgery comes with its own complications. Right. I mean, the complications may arise, it may not arise. You can never tell. And it's not an error from the doctor or maybe the anesthetist. No. But complications do occur. So far as we are humans, I mean, things are bound to.
Yeah.
Okay, so we try a bit to be cautious before we say, okay, this has to be operated on. You get it? Yeah. Also, if you're a young woman and you don't even have a partner, you're not getting married anytime soon, we'll manage the symptoms for you.
Right.
So that when you are ready to get pregnant or get married or have children, and you try and you're not able to conceive, then yes, then we'll go ahead and do the surgery for you. But it also depends on how big it is too.
Yes, and the position.
Yes, exactly.
So how important is it for women of reproductive age, whether partnered or not partnered, to just be on top of our reproductive health? Because it sounds to me that it's something that the earlier you find it, the better. Yeah. You're able to explore different treatment options. You're able to actually have a relationship with your GP or your gynae. Yeah. You know, can we talk a little bit more about the importance of just having a reproductive health routine?
Okay. Yeah, it's very important because, like I said in our previous video, listen to your body, because anything that will happen to you, you start feeling it in your body. Yeah. So if, let's say you start feeling this palpable, or you're able to palpate this mass in your abdomen, that means it's quite big. Because usually the uterus is supposed to be below the pelvic bone. It's within the pelvic cavity. So far as you start feeling any mass in your abdomen, then that means that it's quite big, and it's increased. It may increase in size, like I said, because of the exposure to estrogen during our reproductive years. So yes, it's important to listen to your body. If you notice a change in your menstrual cycle, sometimes too, I forgot in the previous video, sometimes too they may present with bleeding in between their cycles. Right. Yes, when it's not time to bleed. It may be from fibroid. It may also be from something else. But let something prompt you to pay attention to your body. That no, this is wrong. This is different. Let me just go and check on it. Yes, basically.
Right. Because I'm getting the sense, or at least the older I'm getting, I'm now really understanding the importance of womb health to whole health. Yeah. I think as women, our womb is like the center of really the health of the rest of our body.
Yeah, exactly.
Wow. So somebody says, I have fibroids, but I don't want a medical solution to this. What are some other things that we can pay attention to, especially in our lifestyles?
So there are some studies that have indicated that taking red meat also increases your risk of
serious complications of fibroids?
No, increases your risk of developing fibroids.
Is it? Okay.
So if lifestyle, then maybe you may want to reduce your intake of red meat. And then also basically living healthy. Yeah. But like I said, some of the risk factors are inherent. So whether you live healthy or you don't, you may still develop the fibroids.
Yeah.
Yes,
I'm plant-based, and I obviously, I had a family history of fibroids, and so for me, I feel like that was probably more of it was more of a genetic, a genetic thing. But I will say this, that my symptoms for the size and the position of my fibroids, my doctor, I had somewhat heavy bleeding, but I had a very normal period. When I got my fibroid surgery, my doctor actually said that he was surprised I didn't have worse symptoms. Yeah. And I think it has something to do with
living healthy.
Yeah, absolutely. Probably, eating well. I drink a lot of green juice and greens, and I exercise quite a bit. So just keeping my weight healthy and eating.
Because weight gain or obesity is also an increased risk. So if you keep healthy, it may also reduce that risk on that side for you.
Yeah.
Because even if you have a family history, environmental factors also come into play.
Right.
Before, example, if someone has a family history of diabetes, she doesn't have diabetes, but there's a risk factor there. So depending on your environmental factors, your lifestyle can predispose you to developing the disease.
Right.
So same with fibroid. If there's a family history, your lifestyle should also, will also determine whether you may develop it or not. Yes, even if you are living the best, form of health or cleanest lifestyle, because of that family risk, you may develop fibroid. Also, because you're also living very clean too, you may not develop fibroids. Exactly.
Yeah. So it's very important. I like the lifestyle aspect, because some people might say, look, I feel better when I know I feel better when I'm eating plant-based. I know I feel better when I'm increasing my greens. I know I feel better when I'm not eating a lot of starch or red meat or whatever the case is. And like you said, listen to your body. If you know that, I had a period where I tested out I was eating, they call it alkaline. And I immediately saw a difference in my period. Okay. I practically had no cramps. It just, all the symptoms had improved. And so for me, that was proof that, okay,
lifestyle really, really helps. Exactly.
Lifestyle really, really helps.
And it shouldn't just be living healthy for fibroid development. Total body.
Standard.
Exactly.
Standard.
Exactly.
I love this conversation because I don't think I really understood the importance of womb health.
Yeah.
To eating from my womb, literally. I eat for my gut. Obviously, they say eat for your gut, so you're regular and everything. But realizing how much as women our womb health, is really our wealth.
Yeah, it's very true. Because like we said earlier, any form of infertility or any form of issue that has to do with childbearing is blamed on the woman. So of course, our womb is our wealth.
Yeah, on so many levels. And even just the hormone, I didn't even realize that sugar spikes and all that stuff affect your hormones, and hormones affect fibroids, and it becomes a cycle.
Exactly. So everything is connected in the body. Everything. Wow. Right from the top to the bottom. Yes.
Right.
Exactly. And then I think you asked the question about the surgeries.
Surgeries, yeah. So within surgeries, I understand that there's levels to this.
Yeah. So the main ones are the myomectomy, which is just taking out the fibroids and then leaving the womb intact or the uterus intact. And then we have 1, 2 that is taking out the whole uterus. Hysterectomy, exactly. Now for the myomectomy, so we have you can either go by the invasive or minimally invasive. So the invasive ones is cutting you open to perform the surgery for you. And then the minimally invasive ones is the laparoscopy and then the hysteroscopies. Exactly. So depending on if the fibroid is probably, you can also have another type of fibroid which may be in the womb, but it's pedunculated. By pedunculated means it is on a stalk, like a pendulum.
Oh, so it's kind of dangling.
Yes. No, not dangling per se, but there's a thread.
Yes.
Before you have the ball. So yes, so kind of so it's
like a fruit.
Exactly. So it's attaching to the womb and it's hanging.
Okay.
So with that type of fibroid, we could do the what we call hysteroscopic surgery, and then they cut it out, they resect it for you, and you're good to go.
I have a funny story about the invasive versus minimally invasive one after you're done.
And then also we can also have the vaginal hysterectomy. So instead of cutting you open, we could also go vaginally to take out the uterus, also depending on the size of the uterus. And then for the myomectomy, we have the abdominal route. We can also do laparoscopic route. It also depends on the size and then the number of nodules that you have, exactly. But the advantages with the minimally invasive ones is, less hospital stay compared to the open surgery where you have longer hospital stay.
It can even be outpatient.
Exactly, exactly. And then also the post-op complications that you may also have. You may have more pain with the open surgery compared to the minimally invasive surgeries. Exactly. So these are forms of surgical management of the...
What about embolization?
Yes, so there was also what we call the uterine artery embolization. Yes, that one too is a minimally invasive surgery, but it's done mainly by the radiologists.
Okay.
Yes, in conjunction with the gynecologist as well.
And what exactly does it do?
Okay, so this one, you are trying to occlude the blood vessel that supplies the uterus. Because fibroid just doesn't depend.
People. What is
okay, so fibroid doesn't just depend on the hormones. It also blood supply.
Blood supply.
Exactly. So occluding means you are putting something into a tube or into the vessel to block it. So if like a barrier, if there's a barrier, you can't go through.
I see.
Exactly, and you can also come through. So basically, that's what they do. They put in some device through your something we call the femoral artery, and then they direct it under X-ray guidance, and then look for the uterine arteries, because the uterus is supplied by the vessels we call uterine vessels. So we have the uterine artery. They put in some bands or blockages into the artery to prevent the artery from supplying the the uterus.
But can that cause infertility if you're blocking blood supply?
So the uterus has collaterals.
Okay.
A lot of collaterals, blood supply, different forms. You can get blood supply from the ovarian vessels to supply. So there's collaterals to supplying the, the uterus. But usually the uterine artery embolization is reserved for probably those who have completed their family, because everything comes with its own
risks,
complications and risks as well. So basically,
yeah. And that's what I want to talk about. All of these, on the spectrum, what poses the highest risk?
Okay.
Or the highest risk of complication? Okay.
So with the uterine artery embolization, so I'll use UAE. Okay. For the UAE, also less hospital stay, but there's also the risk of recurrence too.
Okay.
As well, exactly.
So
you have to weigh the options and see which one is best for this individual, which one is not best for this individual. UAE, uterine artery embolization, can also be used for treating other things. Same as surgery can also be used to treat other conditions. But mainly what we do here is the myomectomies and then the hysterectomies. Exactly. Those are what we usually do here in this country, in Ghana. Exactly. Yes. But we have a clinic that is open that's doing these minimally invasive surgeries. I'm yet to see one done anyway. So.
Okay, here. Yes. Yeah. So thank you for that. I really, really appreciate this conversation, because when I had my fibroid issue, I was trying to push really hard for a minimally invasive myomectomy. And the first doctor was like, girl, bye. It's in the back of the uterus. Yeah. We really need to get to it. And I went for a second opinion, which I do encourage. Always look for a second opinion it's very important. I went for a second opinion, literally same diagnosis, same treatment option was given. And so I gave in and said, okay, great. It looks like I kind of have no choice because of the look. Mine was more the location than the size. Yeah. Mine was more the location than the size. So because of the location, and it's been great. I will say that post-surgery, I barely have cramps during my period.
And you're living healthy.
I'm living healthy. Yes, I'm continuing living healthy. And also I have experienced less bleeding. So I used to have a 6 or 7 day period, and now I have about 4 or 5 day period. Okay. So
and the quantity has reduced too?
Quantity is significantly reduced. Okay. I can't even begin to tell you how often I have to change tampons and pads. And I wish I could go all in on video. I don't know how much people want to know about that, but significantly. I mean, I can't even begin to... I don't have to stay at home anymore on my periods. I literally had to stay home on my periods. Wow. You know,
the bleeding can be heavy. And quite troublesome.
And the cramps. Yeah. I mean, I used to take pills. I don't remember the last time I even bought a painkiller. Yeah. But I used to need to have painkillers everywhere in my house. Exactly. Downstairs, upstairs, it had to be.
The pain can be bad. The bleeding can be very bad.
Yeah. 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 Terrible.
But thank God for his mercies.
We thank God. Indeed, we did. And we thank God for doctors like you who are doing the work of helping us, you know, reclaim a piece of our experience. Yeah. So thank you, doctor.
Thank you too for having me.
So you heard it from here. The treatment options available, always surgery, minimally invasive or fully invasive. But also don't forget the lifestyle is very important. Live healthy, reduce intake of red meat, as Dr. Sowah mentioned, and try to get exercise, drink water. We all know what it takes to be healthy. We just have to implement it. Once again, I'm Nana Konamah, and I'm here to help you find your authentic self. Head to nanakonamah.com to read up on our fibroid activism and join the conversation. You will be also able to learn and read up on our short-term, medium-term, and long-term goals for our fibroid activism. Also, if you like this video, go ahead and like it. And don't forget to click subscribe right down below this video. Once again, I'm Nana Konamah, and thank you for joining me.